Hey everyone, I'm Dr. Stephanie. I'm a physical therapist, and today we're going to go over rotator cuff injuries. We're going to go over what causes them, how we treat them, how we get rid of the pain, and how you can actually prevent surgery. So, the rotator cuff consists of four muscles in the upper back and shoulder region. Those muscles are the supraspinatus, the infraspinatus, the teres minor, and the subscapularis. These muscles function to stabilize the shoulder. They also function to elevate, to abduct, and to perform internal and external rotation. A lot of people get rotator cuff injuries, and they can be caused by a variety of different reasons. One is a traumatic injury, and so that's if you fall, or if you fall down the stairs and grab the railing, or if you just reach out and grab something. Those all can cause a rotator cuff tear, or just tendonitis, or a muscle strain as well. You can also have an overuse injury, which is much more common. So that is a lot of throwing athletes get those. So if you're throwing a lot, then that can cause the muscle to be overused, and it can cause tendonitis, or it can actually cause a tear as well. You can also get tendonitis from your job. If you're doing something like painting, painters get it a lot because you're holding your arm up like this and just painting. Hairdressers as well, anything where you're holding your arms up like this, or you're just using your arm and your shoulder a whole lot can cause that. Sometimes people just, from over the years of using their arm and shoulder, start to develop pain and then figure out they have tendonitis or a tear. All of these can be treated in a similar way. You can treat the same whether someone has a rotator cuff tear or if it's tendonitis. Basically, the goal is to strengthen those muscles in the rotator cuff and surrounding the shoulder to build that strength and stability back up to support the shoulder joint, even if you have a tear in there. And that can actually prevent you from having to have surgery. If you build up enough strength there, you can decrease the pain and go on with your life and use your shoulder and arm just like you did before without having surgery. So I'm going to go through a series of exercises that I like to use to build that shoulder strength, to build that rotator cuff strength, and you can use these too. So we're going to start with a set of small weights. So I have 3 pounds here, but it depends on the person. You might want to start with no weight if you're having a lot of pain, and then gradually move up 1 pound at a time. The rotator cuff muscles are small muscles, so you're never going to use huge weights. Even if you can lift them or throw them up there, you don't want to do that because then you're using the bigger muscles and not those smaller stabilizing muscles. So we're going to start with 3 pounds, and we're going to start with shoulder scaption. So scaption is just lifting your arms up at a 45-degree angle like this and then back down. So you want to make sure you're not too far in front of you or too far out to the side, and you want your thumbs up towards the ceiling. So I like to do this a little, you can do it standing straight up, but I like to have a little bent over right here. So what you're going to do is just lift up, 45-degree angle, be bent over a little bit, and I like to do 3 sets of 10 of this. And it should be pretty easy in the beginning, but as you get to number 10, it should get pretty tough. And if it's not tough, then I would go up in weight. So I'm going to show you from the side as well. So you're going to bent over a little bit. You want your everything in line, so head in line with your back. You're just going to come up like this. You're going to do a set of 10. And then you want to rest after the set of 10, rest for a couple seconds, and then repeat a set of 10, rest for a few seconds, repeat another set of 10. Okay, the next exercise, we're going to stay bent over, and thumbs are still going to be up towards the ceiling, and you come straight out to the side. This one will be a little bit tougher, so you may need to go down in weight. And we're going to also do a set of 10, and then we'll take a break after 10, and then you're going to repeat 2 more times. So I'm going to show you that from the side too. So bent over a little bit, thumbs up towards the ceiling, straight out towards the side. Just like that. Okay, another exercise, we're going to do one more with the weights that I like to do is a row. So this one may be a little bit easier than the other two, so you may need to go up in weight. I'm going to just keep these weights just for demonstration purposes. Okay, so you're going to bend over a little bit, same thing like the other two. Just going to row up, and you want to make sure you kind of squeeze your shoulder blades together too. So you don't want to keep your shoulders kind of rounded forward. You want to make sure you kind of keep them back and pull up and squeeze your shoulder blades together. So we're going to also do 3 sets of 10 of these. And make sure you do 10 and then take a little break and then do 2 more sets like that. Okay, we're going to put the weights down and we're going to grab a band. So this is a long band, and these also come in different resistances. So you want to start with a light band, and then as you get stronger, you can move up resistance. I like to get bands that are, or I like to buy a set of bands so that as soon as you're ready to move up to the next resistance, you can do that. So what we're going to do with this, we're going to start, hold it like this, palms up, elbows in by your sides. You want to make sure you're kind of squeezing your shoulder blades. Let me show you from the back. So you don't want shoulders rounded forward. You also don't want to look down. You want to keep your head straight ahead. You want good posture, shoulders back like this. And then what you're going to do, elbows by your side, you're just going to pull out to the side like this. And it should be, again, hard as you're approaching number 10 of the first set. And if it's not hard, definitely go up in resistance. But we're also going to do 3 sets of 10. So you're going to do 10, you're going to take a little break, and then repeat that 2 more times. Show you that from the side. So shoulders back, you're just going to pull out like that. Okay, we're going to do 1 more with this long band. After that one, you're going to put your arms straight out in front of you, palms down. You're going to pull across as far as you can, and then back together slowly. All of these, it's important to go slow, because if you go too fast, then it doesn't work the right muscles, and you'll figure out if you go slow, it's much harder than if you go fast. So especially when you go back together on this one, nice and slow. So we're going to do 10, and then you'll take a break, and then repeat that 2 more times. You also want to have good posture on this one, so make sure you're looking straight ahead. Kind of keep your shoulders back a little bit and pull across. A lot of people tend to, when they go up here, bring their shoulders forward, but this, we want to keep our shoulders back the whole time. So just like that, we'll just pull straight across. And you should start with some resistance, so you don't want to start with no resistance here. So start with it pulled apart a little bit and then pull straight across. Okay, 1 more piece of equipment. Now we're going to use a loop band. Same thing with these. You can buy a pack with all different resistances. Start with the lightest, work your way up. So for this, what we're going to do first is you're going to keep some resistance in it. Pull your hands apart a little bit and keep that resistance as you lift your arms up overhead as high as you can. And then back down. It'll seem pretty easy at first, but you'll notice it'll get harder and harder as you do more. We're going to do 3 sets of 10 of these as well. And just go up as high as you can. Keep your head straight ahead. Keep good posture. I'm going to show you this from the side. Just like that. So we're going to do 3 sets of 10. As I was doing that, my shoulder was popping a little bit, and that's okay. It didn't hurt. It's just normal to have a little bit of popping. So if you're feeling some popping, that's okay. That just means you're working, and it really means nothing. If it's painful, you don't want to work through that. But if it's not painful, it's perfectly fine. Okay, so that comes to an end to our exercises. So I would recommend doing all of those exercises at least every other day. I wouldn't do them every day, just to give your shoulders a little bit of a break to kind of rest and recover. But definitely do them every other day and work on building up that rotator cuff strength. And if you get strong enough, you can get rid of that pain and you can actually prevent surgery.